Hello everyone and welcome to this audio podcast. This audio podcast is part of the Calyces Chronicle series. This audio podcast is part of the MaelZtorm Cortex. This audio podcast is part of a lab-agnostic analysis, and this audio podcast is part of a Storm Robotics production. In this audio podcast, we'll just have a brief into the implications for practice. So, with regard to specific areas of practice, clinical practice and research, more qualitative research is important to understand actual perspectives from young people, from a young CKD population, and for future interventions, and to identify how care should be made more explicit for them. And with sort of the advancing clinical aspects around practice and research, there needs to also be sort of collaborations and a much needed reform is an original coping service framework catered explicit to young people who suffer with CKD, and this document should be an inherent part of a recipient or patient's a young patient's or young CKD patient's care plan. That draws this audio podcast to a close. There's been an audio podcast as part of the Calyces Chronicle, an audio podcast as part of the MaelZtorm Cortex, and an audio podcast as part of a lab-agnostics analysis, an audio podcast as part of a Storm Robotics production.